Welcome back to the ACT program webinars for healthcare professionals. I'm Ashley Loudermilk, Clinician Engagement Partner for Ingenovis Health. I'm filling in for Dr. Geiger today, who was unable to join, but I'm sure she's listening in. We are excited to introduce and welcome our speaker today, Ms. Bree Becker. Bree is one of the founding members of a healthcare technology company called Matchwell, where she works as the Director of Clinical and Quality. She also works as a nurse practitioner for Northside Cardiovascular Care's Maternal Heart Health Clinic. She sits on the board of directors for the Georgia Nurses Association and is a contributing writer for Medscape. Bree has dedicated her time to mentoring graduate nursing students for North Central and National University for several years, and we are lucky to have her speak with us today. And now, Ms. Bree Becker.
Thank you so much for that kind introduction, everyone. And thank you, Dr. Geiger and Ashley. So I'm going to go ahead and share my screen so that we can get started with today's presentation. But I first want to just say Happy Nurses Week to everyone out there. I'm honored that I get to be here with you today, but extra special that I get to do it for Nurses Week. And I'm excited to share with you some best practices regarding cardiovascular health. And to me, there's no better self-care than cardiac prevention. So as Ashley said, I currently work in workforce solutions, and I also work as a nurse practitioner in cardio obstetrics. So I see women who are recovering from preeclampsia, and cardiac disease prevention is a huge component of what I spend my time talking about with patients every week. So I'm glad that I get to share some of these nuggets with you today. So just to kind of quickly give you a high-level overview of what we'll cover in the next 45 minutes, we're going to look at the components of cardiovascular health, analyze some data that shows why nurses might be at higher risk compared to our peers for cardiovascular disease. And finally, we're going to look at developing a personalized plan for you that focuses on your modifiable risk factors so that we can decrease your risk for cardiovascular disease. So to get us started, I wanted to just share with you some cardio fast facts. You guys are probably aware of a lot of these, but we know that heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. We know that one death every 34 seconds in the United States is related to cardiovascular disease. And about 697,000 people in the US die from heart disease, which is it accounts for about 1 in every 5 deaths. There's also a financial cost related to cardiac disease. So $229 billion are spent in healthcare services, medication, and also just loss of productivity due to missed work and death. And 2 out of 10 deaths occur in people under the age of 65. So more and more we're seeing that cardiovascular disease is not just a disease of the aging population, but we're starting to see it in much younger populations, and we're starting to see mortality in younger populations. So we know that it's something that specifically our country really needs to pay attention to. So for a quick story, so when I first became a registered nurse, I worked on a postpartum unit, and I was about 2 years into nursing, and we had a close coworker on our unit suddenly die from a heart attack. So sudden that she was supposed to show up for work for the 7 a.m. shift. She wasn't there. We were all wondering where she was. And her husband actually called in to say, I woke up this morning and found her dead, and she had a heart attack. And so obviously we were all devastated, shocked. And over the weeks, as we were dealing with our grief and just processing what happened, we started to talk. We were talking amongst ourselves and said, I do remember she seemed kind of short of breath, and she just didn't seem herself. And she seemed to really be struggling. And it got me thinking about, why is it and how was it that a registered nurse with so much experience and so much knowledge, who was with other registered nurses with experience and knowledge, how are we all able to miss that? How did we not see that? And is there something that we could have done that maybe could have prevented that? So you can imagine that I was really intrigued. In 2019, the American Heart Association released a study that they presented in Philadelphia that showed that specific jobs were linked to poor cardiovascular health in women. So this study looked at postmenopausal women, about 65,000 postmenopausal women, and they found that healthcare tended to be a job associated with higher cardiovascular risk. So specifically nurse aides, nurses, psychiatric nurses, that you can see the top three were social workers had a 36% increased risk, retail cashiers, 33% increased risk, and then registered nurses, 14% increased risk compared to our peers. So it was really interesting to me, again, that despite our knowledge and our expertise, nurses are still having cardiovascular disease. And the American Heart Association, along with the World Health Association, recognizes the key role that nurses play in global health reduction of death and disability from cardiovascular disease. So decades, nurses, advanced practice nurses, we have taken on these frontline roles of managing single and multiple risk factors for cardiovascular disease like hypertension, smoking cessation programs, high cholesterol, diabetes. We're key in managing these conditions, but there's this substantial gap between what we teach our patients versus what we're doing in our own lives. So we're not caring for ourselves the way we care for our patients, despite our vast amount of knowledge. So when I talk to patients about cardiovascular health, I like to break things into three buckets. So you'll see that there's like a theme of threes throughout this presentation. So that's a adult learning theory that goes all the way back to like kindergarten. You know, when you first learn, it's ABCs, 1, 2, 3. So our brains just tend to absorb information if we can chunk it into three pieces. So when I talk about cardiovascular health, I talk about the vascular system, blood viscosity, and the nervous system. So we know that the vascular system is what moves oxygenated blood throughout our body, specifically to our vital organs. And when there's plaque buildup, that can lead to blockages, which can cause inflammation. It can cause constriction of the vessels, which means those vital organs are not going to get the oxygen that they need. So it leads to diseases such as high blood pressure, stroke, myocardial infarction, even kidney disease. When we look at blood viscosity, that also affects our heart, specifically when we think about diabetes. And it's estimated that about 1 in 10 Americans suffer from type 2 diabetes. So the more blood or sugar you have circulating in your blood, the more viscous and thick that blood is, which means your heart and vascular system have to work harder and and work in overtime so that they can pump that oxygenated blood throughout your system. And when we have that over, 10, 15 years, our heart and our vascular system becomes less effective at pumping. And then finally, the nervous system. So we know that stress plays a component in heart disease as well. There's a Lancet study from 2017 that showed chronic stress, which we know leads to anxiety, depression, sleep deprivation. They're all linked to increased cardiovascular disease. And remember, when our bodies are under stress, and the stress is really only designed for like short amounts of time, right? So I was a little bit stressed in preparing for today's presentation, but that's what gave me the energy to prepare. But when your body is in that chronic state of stress all the time, cortisol and adrenaline is constantly circulating throughout your body. And so that leads to long-term problems for all of our body systems, but specifically for our cardiac system. We'll see elevated blood pressures, elevated heart rates, inflammation in your arteries and your vessels become less pliable, thus or increasing your risk for stroke or MI. So there's 3 common diseases, or what I call gateway diseases, that we want to screen all of our patients for. And as healthcare workers, we need to make sure we're being screened for as well, because if they're ignored and not addressed, over time, they lead to more severe cardiovascular disease. So I thought we could just do a quick pulse check and check everyone's knowledge here today. So we're going to initiate our first poll. And I want you to just read through the question. So what are the 3 chronic diseases when they're not managed early can lead to severe cardiovascular disease? So hypertension, depression, anxiety, diabetes, hypertension, hyperlipidemia, congestive heart failure, obesity, and diabetes. So we'll give everybody about 20 seconds to look through that. And it looks like a lot of you are right. So diabetes, hypertension, and hyperlipidemia, those are the 3 gateway diseases that if we ignore over time, that leads to more chronic diseases down the road. So when I talk to patients in my clinic who are recovering from preeclampsia, I urge them all, like, it doesn't just end with the once you recover from preeclampsia, you're now at increased risk for other things down the road. So specifically hypertension. So we know hypertension is broken up into 2 stages. So we've got stage 1, stage 2. Hypertension is so prevalent. It's estimated that about 1 in 2 people in the US have high blood pressure. In cardiology, so you get the official diagnosis of hypertension when you have 2 or more blood pressure readings obtained over 2 or more visits. Or if, we do have some patients who get very nervous when they come into the doctor's office, and so their blood pressure is elevated. So we have them check their blood pressure at home. And when approximately 85% of your blood pressure readings are falling into one of these 2 categories, you're going to get a diagnosis of stage 1 or stage 2. So stage 1 is when we have a systolic between 130 to 139, either for 85% of your readings or on 2 different visits, or your diastolic 80 to 90, 85% of the time, or at 2 separate visits. So oftentimes we overlook that diastolic number, but it is just as important as that top number. So remember, the top number is the pressure of your heart when it's squeezing out blood to your arteries and sending that oxygenated blood to your body system. And the diastolic is that pressure in your heart as your heart is filling with blood. So if that pressure is really high, we're going to have less filling, which means over time, we're going to have the heart pumping less effectively. So that number is equally as important. And then stage 2 is when we have a systolic greater than or equal to 140 or a diastolic greater than or equal to 90. So usually for stage 1, we'll recommend lifestyle modifications. Even with stage 2 lifestyle modifications, we'll give patients 6 to 8 weeks to make some changes. The doctor who trained me, he always says that the best medication is no medication. The second best medication is the one you need. So we don't want to just hand out medication to everyone. We want to give people the opportunity to make some lifestyle changes. Second, type 2 diabetes, again, very prevalent in the US. 2 categories, we have pre-diabetic and diabetic. So we're looking at your hemoglobin A1C, which gives us an average of your blood sugar over time. So that pre-diabetic range is 5.7 to 6.4. What gets you the diagnosis of diabetes is when it's 6.5 or higher. And then hyperlipidemia or high cholesterol. So we're looking at 2 different categories. And now I will tell you, there is a lot of literature out there now looking at all the different types of cholesterol and different parameters for treating cholesterol, but we're keeping it pretty high level today in basic. But what you need to know is high density lipoprotein, that's your good cholesterol. So that's the cholesterol that essentially is able to go and pick up the bad cholesterol in your blood. It takes it back to the liver, so it's broken down and removed from your body. So HDL is your good cholesterol. For men, we want that number to be greater than 40. And for women, we want that number to be greater than 50. So oftentimes I'll have patients who are concerned because their HDL is flagged as high, but that's actually good because that prevents plaque buildup from your bad cholesterol, which is your LDL, the low density lipoprotein. So that's what actually can go into your arteries and vessels and turns into plaque and builds up over time. And if it breaks off, we can have clots, and that's what leads to either ischemic heart attacks, or we could have, a stroke from a blood clot moving throughout your body. But we do always want to consider when we're treating high cholesterol, the preventative effects of HDL. So even if we have somebody with LDL who falls within that borderline or high, if they have really good HDL, we may not have to treat. So then why is it that nurses are at higher risk? So I'm sure a lot of you in the audience have some opinions and even have read some literature out there about this, why we would be at higher risk. Our company surveyed our own network of nurses, and we discovered a couple of interesting things. So one that, about almost half of the nurses we surveyed report that they haven't been able to decrease or manage their own stress. So if we think back to the components of cardiovascular disease and that nervous system, stress is a component. And then 90% reported lack of time as their biggest barrier to providing self-care practices, such as exercise and eating right and mental health. All of that kind of, falls into that same category. Second to that, only 13% said that it was financial reasons. So we are looking at nurses not being able to manage their stress, and then the majority saying that they don't have the time to implement self-care practices. And then many organizations are just not addressing it. So close to 25% said that, despite these numbers, their organization still wasn't doing anything to help. So you could maybe assume or make a conjecture that nurses might be at higher risk because we're under a lot of chronic stress, and we've got, many factors that are preventing us from caring for ourselves. We know that the rates of burnout are at all-time levels of high, and, over the last few decades, we've kind of been left to our own devices to figure out this burnout on our own. The good news is that we are seeing this change, and more organizations are starting to put some wellness programs in place for nurses, which I think is great. So let's do our second poll question. So we'll activate that. And I want you, there's no right or wrong answer here. Why do you think that clinicians or nurses are at higher risk for cardiovascular disease? Is it the long shift hours, chronic stress, lack of sleep, too busy caring for others and not enough time to care for themselves? What do you guys think? And once everybody has had a chance to answer, we'll close that poll out. And so 9% long shift hours, chronic stress, kind of second place, but a large majority of you too busy caring for others and not enough time to incorporate self-care. I would say that I have to agree with that, which today I think we're going to start doing something about that today. So if you're here today, you're, step number one, you are trying to learn ways that you can start taking care of yourself. There was a study released in 2019 that looked at specifically at cardiovascular disease and nurses. And they interestingly found that long work hours, and the study defined long work hours as working more than 10 hours for at least 50 days per year. So if you are a bedside nurse, you work 12-hour shifts, 3 days a week. So that's more than 50 days a year. And in that particular study, groups of workers who worked those hours had higher rates, specifically stroke. They also interestingly found that nurses with high blood pressure and who had high physical activity on their jobs, so if their jobs were physically demanding, had nearly 3 times a higher risk of heart disease compared to nurses with normal blood pressure and moderate activity or moderate physicality on their job. So this is something important, especially when we start to talk about cardiac prevention and activity. Physically demanding jobs do not necessarily prevent cardiac disease. That's not the type of activity that we're talking about when we see cardiac prevention. And then overall, long hours, high stress, and the physical demands of the job, were all related to being factors for cardiovascular disease. So kind of the meat of why we are here today. So how do we break this cycle? How do we start caring for ourselves the way that we are caring for our patients? So I want to provide you in the next 15 to 20 minutes some tips and tricks that I give to my patients that I work with weekly so that you can create your own self-care care plan for yourself and start incorporating some of these tricks and tips into your own life. So again, we've got our 3 buckets, right? So when we look at cardiac disease prevention, there's 3 buckets. So there's knowledge, there's nutrition, and there's activity. So with knowledge, the really cool thing about cardiac prevention is about 80% falls within our control. So I don't know of really any other disease process out there that we as humans have so much control over, but that is always good news to me. So 20% we can't do anything about. Those are our non-modifiable risk factors. So aging, genetics, your personal history. We can't do anything about that. We kind of have to put it in a box, put a bow on it, and put it on the shelf. But there is a lot that falls within our control. So being knowledgeable about weight, what's a healthy weight for you, specifically like your waist circumference, nutrition, activity, knowing your numbers. You would be surprised how many people don't know what their blood pressure is because they don't check it. And then access to care is a big one as well. So if you don't have a primary care provider or a general practitioner, whether it's a nurse practitioner, a physician's assistant, it doesn't matter. But if you don't have a doctor or provider that you're seeing yearly for physicals, that does increase your risk for cardiovascular disease. Because remember, a lot of these, those gateway diseases we screen for, and if we can catch them early, we can change that trajectory overall. These are some useful tools. So you guys may have heard of these before. So if you scan the QR code, I'll leave this up for a minute. So there's the Framingham score, cardiovascular risk assessment, and then the American College of Cardiology has their own risk assessment. But these are just tools, and I have these actually flagged and saved on my phone. They're really fun. Just you put your age, your race, your systolic blood pressure, your most recent cholesterol readings, whether you're a smoker, whether you take medication for high blood pressure, and it shoots out and calculates the score for you, and it lets you know what is your cardiovascular risk score over time. And so to me, this is a great quantitative way to show patients this is why we need to worry today about managing your weight or managing your blood pressure. So this is an example of the Framingham score. And I actually put in my own information so everybody gets to see what my cholesterol is. So you can see my race, I'm female, 43, total cholesterol of 234. My HDL is 48, so I got to work on that. My systolic blood pressure 110. I don't take blood pressure medication. I don't smoke and I don't have diabetes. And it calculated for me a risk score of 0.8%. So your risk is considered low if the Framingham score is less than 10%, moderate if it's 10 to 19%, and it's high if it's 20% or higher. So this is a great tool to use, especially if you have patients that you're talking to, family members that you're talking to that maybe you're trying to brush off, I have high blood pressure, but I don't feel bad. I feel great. This is a great tool to use to say, like, when we talk about cardiac prevention, it's longevity. So we're not talking about the today, but we're talking about how do we have a long, healthy life. Nutrition. So this is going to be another big hitter when it comes to cardiac prevention. And I will tell you, culturally, we are set up to fail with nutrition. It is so easy. I mean, fast food is just a click away from your phone, right? So, and when we come home from a long day at work, it's so easy to use Uber Eats or Grubhub and all of those apps that, send us food so quickly. So nutrition is going to be something that we really have to focus on. And I think of nutrition as fueling your body. So it's not about being a certain weight or a certain size or looking a certain way, but it's about what is it that you want to put in your body so that your body lasts longer. And one thing that I share with all of my patients is the DASH eating plan, which many of you have probably heard of. We'll go over that in a minute. In addition to, looking at your sodium intake, which is really important. And then alcohol consumption. So, I mean, we've seen higher rates of alcohol consumption since COVID than we've ever seen before. People were sheltering in place. We have higher rates of anxiety and depression. And of course, people are self-medicating. So we want to really limit our alcohol consumption for women, 1 serving a day. And 1 serving is not like that big glass of wine. That's like a 5-ounce glass of wine, 12 ounces of beer, 1.5 ounces of like a whiskey or dark liquor. For men, they can have up to 2 servings. So decreasing your alcohol consumption is going to be huge. And stopping smoking. I think everybody is well aware that tobacco, over time, it increases your blood pressure because it causes arterial stiffness. So the DASH eating plan, I think it's very similar to like a Mediterranean diet. And I like it because it's a non-restrictive eating plan. So it's lots of fresh fruits and vegetables. So we want 4 to 6 fresh veggies a day, 3 to 4 fruits, lean meats. So I always tell patients if it swims or has wings, that's good. So, the high fat meat, that's what we want to try to limit in our diet. Dairy, we want to make sure we're having 2 to 3 servings of that, but it needs to be on the lower end of fat. So 1 or 2%, things like cottage cheese, yogurt, string cheese. And then we also want to have healthy fat because fat is actually good for you. Your body needs that. So, things like olive oil, avocados, avocado oil, sesame oil. So when you're doing your own food preparation, we want to incorporate fat. We don't want to eat a non-fat diet. And especially when you start to buy processed foods that are low fat, oftentimes they are filled with sugars because that's what substitutes the fats to give it taste. So the Mediterranean diet or DASH diet is a great eating plan. And again, it gives you a variety of foods that you can eat. And it's not as restricting as some diets are. The other thing I like about the DASH eating plan is that, carbs are totally fine. Your body actually needs carbs. So we recommend 6 to 8 complex carbohydrates per day. So there's simple carbs, there's complex carbs. When I think of simple carbs, basically that means it's very easy for your body to digest it. So when you think about a Lay's potato chip, so if you put a potato chip in your mouth without chewing it or anything, it will eventually dissolve pretty quickly. That's a simple carb. But if you take a whole grain piece of bread and you stick that in your mouth, well, you've got to actually work hard to digest that. So that's a complex carb. So that's what we're talking about when we say carbs. We want 6 to 8 of those per day. So this is not a no carb or a keto eating plan. And then the other thing that's really important is monitoring your sodium intake. So the daily recommendation for people without high blood pressure is 2,300 milligrams of sodium. If you have high blood pressure, we would recommend that you stay under 2,000 milligrams. About 80% of our excess sodium comes from restaurant foods or packaged foods. So the more you can prepare your food at home and use fresh ingredients, the less sodium you're going to have in your diet. So I tell patients all the time, table salt is fine. Actually, about 11% of your salt consumption comes from table salt. It's the packaged food, it's the restaurant foods, even, salads that you buy at restaurants. They're going to have higher levels of sodium because salt is a preservative and it helps the food last longer. So the more you can prep your food at home, you'll drastically decrease your sodium. And I usually tell patients, you don't even have to track your sodium. If you're limiting your restaurant foods and packaged foods, then you won't exceed the sodium intake. And this is a picture, just a little screenshot of a nutrition label. So it's a soup can. So soups are notorious for having high levels of sodium. Frozen foods like Healthy Choice, some of the diet plan foods like Jenny Craig and things like that, they have high levels of sodium. So we have to be careful. So if you look at this soup can, calories, there's 130 calories, there's no fat. You would think that's pretty healthy. It's soup. When you go down to the sodium, it's got a quarter of your daily serving of sodium and just a half a cup. So I don't know about you, but I don't just eat half a cup of soup. So by the time you've had most of that can of soup, you've had your daily consumption of sodium. So pay attention to those food labels. I usually recommend, you want to look at, like, let's say if you want to have a pack of pretzels, 5 to 7%. If the percent daily value falls within that 5 to 7%, that's an okay food to eat if it's packaged. But anything higher than that, that's going to be too much sodium. And then activity. So this is always a fun one to talk about, especially with nurses, because our jobs are so physical. And I can remember working on the floor and looking at my watch and seeing that I had walked 4 miles during a shift. And it's like, oh, I don't have to work out. I just walked 4 miles. But the recommendation for cardiovascular prevention is that you have moderate to intense exercise about 150 minutes per week. So we're going to look in just a minute about how do you know if it's moderate or intense. So I got a easy little formula that you can use. But the good news is that with the 150 minutes, so we know that for nurses specifically, the barrier for self-care is lack of time. So the good news is that we can break that 150 minutes up however we want. So if you want to do a 10-minute brisk walk breakfast, 10-minute walk at lunch, 10-minute walk at dinner, as long as it collectively adds up to 150 minutes for the week, you are preventing cardiovascular disease. There's a big myth that 10,000 steps, is a healthy gauge or goal. There is no science behind 10,000 steps. It's actually an old marketing campaign from about a decade ago for a pedometer or something like that, that a marketing company used and was like, let's focus on 10,000 steps. And that's kind of just turned into culturally. I hear, my friends, family members, coworkers talk about, oh, I got my steps in. But that really doesn't count if your target heart rate is not falling into that moderate to intense range. So how do you know if you're getting that moderate to intense exercise? So your target heart rate is going to be a percentage of your maximum safe heart rate. And you can use that as a guide to know if you're meeting that recommended activity requirements. So first thing, the calculation is 220 minus your age. So that gives you your max heart rate, which means regardless of what type of exercise you're doing, we don't ever want your heart rate to go above that number. So 220 minus your age. And then you multiply that by 50 to 70%. So 0.5 to 0.70. So for someone who's 44 years of age, the target heart rate for moderate to intense activity would be a range of 88 to 123 beats per minute. So if your heart rate is falling within that category, and it's going to be different based on your age, then that lets you know you're achieving those activity requirements to protect your heart. So again, 150 minutes, but it can be broken up however you want. So now I want to do like a little shout out to yoga. So I started doing yoga about 1.5 years ago, and it is one of my favorite types of exercise, especially for those of you who, don't like running or don't like those, Orange Theory classes or high intensity interval trainings. I mean, there's, when I talk about activity, I always tell patients, do something you love. Don't do something that you don't enjoy, because again, we don't have a ton of extra time. So make sure you're doing it. You want to achieve two things. You want to do something you enjoy, and you also want to protect your heart. So if you don't like running, don't pick up running. Do something that you like. But specifically, yoga is great for managing stress, but it also hits those qualifications for exercise. So specifically, studies are showing that there was one study particular that looked at blood pressure measurements in the waist circumference, which are markers for heart disease, improved in middle-aged adults with metabolic syndrome. So with diabetes, obesity, high blood pressure, who practiced yoga for 3 months. So just 3 months of practicing yoga, 150 minutes a week, decreased their waist circumference and also decreased their blood pressure. There was another study that showed slow-paced yoga classes twice a week reduced the frequency of atrial fibrillation episodes in patients with that condition. There was another one that was looking at patients with heart failure. And when they went through an 8-week yoga program, they showed improvement in exercise capacity and quality of life over time. And they also had lower lower blood levels for markers of inflammation, which contribute to heart disease. So yoga is just great. It's a great form of exercise. Particularly if you are interested in free yoga, which is my favorite kind, there is Yoga with Adriene. So if you scan the QR code on the screen, this will take you to a YouTube channel, Yoga with Adriene, and she's got tons of free videos and other resources. She has a newsletter that she sends out. But I did so much yoga with Adriene when we were sheltering in place that I literally felt like I knew her, like she was my best friend. But I've never met her in my life. So that is a great resource, but there's tons of other apps out there that you can get on your phone. I've even, the hospital that I work at, they are starting to create respite rooms for the clinical staff on the unit. And recently I saw that they had put a yoga mat with a poster with some different yoga moves and positions that the staff could do when they go into the respite room. So overall, yoga is a great form of exercise. It increases your strength, your flexibility, but it's also going to get your heart rate up into that cardiac prevention zone. So it's great. So overall, small changes, you will have big results. So, this is some data that I pulled from the American College of Cardiology, just to show you, like, when we're talking about managing blood pressure and metabolic diseases and diabetes, it really is small changes over time, and you will have big results. So for every kilogram of weight, that can equate to 1 millimeter of hemoglobin in your systolic blood pressure. So I tell patients a lot, like, losing 10 pounds could be the difference between one medication or 2 or no medication. So it's not these drastic changes that you have to make. Just a 5 to 10 pound weight loss can give you a change in your blood pressure. Decreasing your sodium or keeping your sodium under 1,500 milligrams can reduce your systolic blood pressure up to 20 millimeters per hemoglobin. So if you have high blood pressure, managing that sodium intake is going to be really important because people with high blood pressure are much more sensitive to sodium. But a 20 millimeter hemoglobin drop, so if you're eating a lot of sodium and your blood pressure is 145, if you can keep it under, 1,100 milligrams, your blood pressure is down to the 120. So that means you may not have to have medication. Exercise. So your blood pressure is actually the lowest right after you exercise. And exercise over time, if you follow that 150-minute recommendation, we can see a 4 to 9 millimeter hemoglobin drop. And then limiting your alcohol can also contribute to a 3 to 4 millimeter per hemoglobin drop. So again, there's just some small modifications that you can make to your lifestyle with your nutrition and your activity and your knowledge. And collectively, these are going to be big results. So my goal with all of my patients is to make sustainable changes over time. You don't want to do drastic things that you're not going to be able to maintain. So we're thinking about sustainability, which is how we're going to have the best success. So we are at the end of the presentation here. I do want to close it out with another poll. So we'll go ahead and activate our final poll. And I would just like to know, so after this presentation, what are some of the small changes that you plan to make to improve your heart health? I'm going to eat more veggies. And so once everybody gets a chance to answer, we will close out that poll and see what everybody is planning to do. So a lot of you in the same boat as me, eat more vegetables. Always need to work on that. Increasing your physical activity. I think that is a great goal. Limiting sweets and preparing more of your meals at home. I think these are some great small changes that hopefully, you'll be able to implement more and more of these changes over time. And overall, maybe in the next 5 to 10 years, they can do another study and show that nurses have some of the lowest rates of cardiovascular disease, right? Because we're doing what we teach our patients. So thank you guys so much for being here today. And I also want to give a quick shout out to ACT for just putting this program together and for everything that they do to care for clinicians, not just nurses, but all healthcare workers. And also wanted to let you know they do have free weekly yoga classes as well. So if you are looking for more free yoga like me, check out ACT. But thank you guys. Here is my email as well as my LinkedIn. So if you scan my QR code, please connect with me on LinkedIn. I'm always looking for more healthcare workers to talk to and network with.
Thank you so much, Bree. That was great and a really helpful reminder for all of us to do better with self-care. Part of my role as a clinician engagement partner is supporting the clinicians through the Ingenovis Health program and improving self-care so, we can all care for others is essential on that. So thank you so much.
Yeah.
We do have a couple questions if you have time and don't mind.
Of course, yeah.
The first question, if you're taking weight loss medication and already losing weight without exercise, is it necessary to exercise?
Yes. Yeah, so exercise, physical activity is good for everyone. Again, that's why, like, I personally, as a provider, try to, unless I have someone that's really falling into that like morbidly obese, super obese category, I try to avoid talking about weight because I do think it sends mixed messages that, like, if you look a certain way, then you're healthy. And that's not true. So even if you are actively losing weight because of maybe you had gastric bypass surgery, or you're on some type of weight loss program, I would always recommend that if you're going to take medication, please get it approved by your doctor first, because there can be some nasty side effects to weight loss medication. But exercise, regardless of your size, is important for cardiovascular health. Absolutely.
Awesome, thank you. Second question, can a stressful job cause heart disease if you are exercising and eating well?
It could. I would say that the literature is, so we can't say there's causality for a stressful job be causing, that it causes heart disease. It's more that the literature shows that stressful jobs contribute to poor habits, which lead to poor health. So there's lots of people that have stressful jobs that are able to, eat nutritiously and have activity, and they manage their chronic stress. So, they whether it's seeing a therapist every week or, talking to friends to help manage their stress. So you can have a stressful job. It's just how you manage that stress. So a stressful job does not necessarily mean that you're going to have heart disease.
Thank you. Thank you.
Great question.
Of course. I think that wrapped up all of the questions that we had. So take this time to thank you, Bree, for joining us today and speaking to us about the heart health. Like I said, it's a great reminder to do better for ourselves. And I also wanted to take the time to thank all the attendees for joining today for our final webinar in our 3-part self-care series. Until next time, everyone, thank you.
Thank you, everybody.